But if my model works, I'm positive people can copy it. And group visits certainly have been part of the solution. You see a lot of patients. You provide more services. You overcome barriers. You do it in a culturally competent way. People get to know one another. They have a better sense of community. They're less scared. They have less anxiety, less stress, and then they have better outcomes. And I get credit for, as a doctor, when my patients have better outcomes and have so little to do with it, that if at least I can put them in a good spot to get healthy, I'm moving the right way.
You're listening to episode number 128 with Dr. Jeff Geller.
Welcome to Pursuing Health. I'm Julie Fouché, family medicine resident and former CrossFit Games athlete. Here, I bring to you information and inspiration from experts and everyday individuals for how to use lifestyle to maximize health. Thank you so much for joining me. Now let's get started with this week's episode.
Hey there, everybody. Thanks so much for tuning in to Pursuing Health. I am very excited to share this episode with you that I recorded with family physician Dr. Jeff Geller. Dr. Geller is a leading expert in addressing the impact of loneliness on our health using group medical visits. A little bit of background about Dr. Geller. He did his undergraduate work in electrical engineering at the University of Massachusetts. He then completed medical school training at Tufts University School of Medicine and residency in family medicine at Greater Lawrence Family Health. He has been conducting group medical visits since 1996, and he's built the largest group medical visit program in the U.S. Through his work with groups, Dr. Geller has pioneered what he calls the empowerment model, which is where small groups of patients work together to improve their health, guided by a medical provider. Dr. Geller has served on the faculty of the University of Massachusetts School of Medicine and Tufts University School of Medicine. He's been involved in research around group visits and loneliness as well throughout this time. He also has a very strong interest in integrative and functional medicine, and he's completed training in acupuncture, osteopathic manipulation, and even hypnosis. He's well known for utilizing evidence-based integrative treatments in an underserved setting. So I recently sat down with Dr. Geller at the Family Medicine Education Consortium Conference to learn more about how loneliness plays a role in our health, how he has implemented group visits in his own practice, and some of the lessons he's learned along the way. Before we get started, I do have a quick reminder that there's still time to join in on our annual Family Christmas Marathon Row. 5 years ago, our family first gathered around the living room on Christmas. We put on our favorite holiday movies, and we took turns rowing until we reached a marathon. That's 42,195 meters. Over the years, what started as a small way to stay active and spend time together during the holidays has grown into a tradition that allows our family and others around the world to give back to a cause near and dear to our hearts. This year, we're choosing to raise money for Barbells for Boobs, an incredible organization that works hard to improve the quality of life of those diagnosed with breast cancer. Breast cancer has hit our family hard in the past couple of years, with my Aunt Nancy currently in remission and Danny's mom, Barbara, now in the midst of her treatment. We've seen how difficult it can be to navigate this process, and we want to give back to an organization that is working hard to make it easier for so many. So if you didn't catch my last episode, number 127, with Barbells for Boobs founder Ziana Hansen, make sure you check that out for more info as well. So hopefully you'll grab a team of family and friends. There's absolutely no limit on how many people on your team. You can split your row distance however you like and row together anytime before midnight on December 31st. You can learn more about how to participate and how to donate to Barbells for Boobs at christmasmarathonrow.com. We hope you'll consider getting a group together this holiday season to join our family and others around the world in this tradition and raise some money for a great cause. Again, that's christmasmarathonrow.com to learn more. Also, before we get started, another reminder that although I am now officially a doctor, this podcast is meant to share the experiences of individuals and does not provide medical advice. So with that, we'll get started with episode number 128 of Pursuing Health featuring Dr. Jeff Geller.
Welcome to Pursuing Health. I'm very excited to be here with Dr. Jeff Geller, and I'm excited to get into all sorts of topics about loneliness, the power of groups, and some of the work that you've been doing over the past couple of decades. So welcome to the podcast.
Thanks for having me.
I thought maybe we could start with just some of your background. So things that you were interested in growing up, and then what brought you to a career in medicine.
Well, I feel like we're all different people at different ages. You know, the things I was interested in growing up was probably basketball. And
Sure.
I don't know how that relates so much to what I ended up doing
Well, we
and where I
did
ended
throw a
up
ball
being.
around in that group I did with you. So
That's-
maybe
that's-
it's playing a role. You know?
That's probably true, and teamwork, and being with other people. So maybe there are connections to
Yeah.
everything we do. I would say that as far as the loneliness topic and things like that, I was probably oblivious to it when I was a child. You know, you might feel lonely, you might see people who are lonely. I probably knew loneliness is bad, right? Like most people.
Doesn't feel good. Yeah.
Doesn't feel good. But it wasn't until I was a resident, so I'm a family physician, and I did a family practice residency. Maybe not even medical school, huh? But somewhere during residency, it really became obvious to me that being ill, it's perception. Being healthy is a perception. You can have really bad diabetes, be losing your toe, but you're happy, you're going about your life, and there's no problem. You could have just a little bit of pain in your toe. You have to quit work. Life's over.
Yeah.
You feel isolated. No one understands you. And so the concept of how perceptive health is just became really fascinating to me. How can I help someone then change this perception when all of my education and training is about reality?
Right. Right. There's so much more into it than just, what the treatment plan is. It's how do we help people to understand and feel motivated and like you said, perceive their health in a positive way.
Yeah. My new quote is, there aren't any good doctors. There are only good patients. And I think right. And how do I help my patients be good is what my life work has been.
That's the secret, right?
Yeah. And probably when I went into medical school, it's like, I want to be a good doctor. I want to make diagnoses. I want to give people the right medicine treatments, and I'm so far away from that. Other than I like people to have the right diagnoses.
Yes, that helps.
But what I've learned more is if I have a good relationship with a person, they'll give me the clues that help figure out what's going on with them, right? And so I don't have to make the diagnosis the first visit. I just have to have a relationship that's good enough, that we'll be together long enough, and that I'll care enough and they'll care enough to tell me that we're working together. We'll figure it out, and so, what you think when you're younger and what actually happens when you're older are just different things. And you'll see that too as you develop your career and go on.
I'm sure. What brought you into medicine and family medicine in the first place? What attracted you to family medicine?
Well, in college, I was an electrical engineer.
Oh, okay. I was biomechanical. No, sorry, biomedical, but I had a bioelectrical focus.
Oh, wow.
Yeah.
Yeah. So, engineering is problem solving. And what I found is I actually worked at Raytheon for some summers, and it was a great experience. However, I learned that there's a moment of creativity, and then you spend a lot of time just figuring things out. And the work environment was very much one of being in cubicles alone most of the time.
Talk about isolation.
Thinking about things.
Yeah.
And then you have meetings.
Yeah.
And sometimes the meetings weren't well, run because they're not being run by facilitators.
Yeah.
They're being run by other engineers, right?
Yeah.
And then you go back in your cubicle and and I guess I know that there's tons of ways to be an engineer, and certainly that's not everyone's experience. But somehow I said to myself, as a junior in college, having done a lot of these internships and ready to start a career in engineering, I'd rather spend more time talking to people. And so an engineering degree has just about all the same prerequisites, as you may know. So I just applied and got into medical school. Oh. And exit stage left, enter stage right. And, the family medicine became obvious to me because I felt, specialized medicine was just learning too little, to learn so little, just learning the foot, just learning the skin, just learning one area. And I know there's a lot in depth you can get in those areas, but I knew I needed to have a broader sense of who people were. Yeah. So family medicine is a way to do psychotherapy. It's a way to get into the insights of people, to motivate people. talk about people's families, their lives, their career goals. It's not just let me look at that mole, which a lot of people enjoy that, and that's important work.
Yeah.
But that wasn't me. So I chose family medicine.
Yeah, and like you mentioned before, that's where the relationship becomes really the center, and that's what you get to do in family medicine. I think that's what drew me to it too, is being able to develop those long-term relationships with people.
Mm-hmm.
So at what point you said you made this realization of how our perceptions are different and how that impacts our health, but when did you really make the realization that loneliness was playing a big role in people's health or in people's perceptions?
Well, you should know I was an introvert. Now I'd consider myself more extroverted.
Oh, wow. I didn't know it was possible to switch.
Well, I think if I, Myers-Briggs, if you test me, I'm probably still an introvert.
Okay.
I like spending time alone.
You can force extroversion when you
I like talking to people.
Yeah.
Right.
Yeah.
If I'm in a room, I'll ask a question. I'll answer a question.
Yep.
I'll participate. When I was younger, I wouldn't.
Okay.
So I think I did change.
That's awesome.
Yeah. So I did research.
Mm-hmm.
So I said, okay, loneliness seems bad. And I found out that there really wasn't a lot of loneliness research.
Okay.
In fact, there was hardly any.
Mm-hmm.
And there are a variety of reasons for that, which are, we can get into the industrial and medical complex at some point.
Definitely.
But, there was some guy, Dr. Brown, studying loneliness, and he created a UCLA loneliness questionnaire. And so I had it translated into Spanish. I did some things. And I started giving it to my patients. And I found out that, hey, guess what? My patients were lonely.
Okay.
Ta-da! And then I did further. I did studies in an emergency room, and I found out that these lonely patients, if you looked back a year, had visited the emergency room almost 3 times more often than the non-lonely patients. Ta-da!
Surprise, surprise.
It's not, right? None of this is a surprise.
Right.
Loneliness is bad
you have
for
to
you.
study it. Yeah, you have
but
to
no one
know.
had really studied
Right.
it. There actually had been some studies in Sweden. They showed that people who were lonely were having more heart attacks.
Okay.
There was a number of things, but nothing really significant. But in my naivete, in my not knowing how important it was, that I had stumbled upon something that could predict emergency room utilization. Suddenly, we were able to get a CDC grant. People were asking me, wow, this is really important. Not because people are lonely, which is really why it's important.
It's
how do we
because
make
of the
people feel
ED.
less lonely?
Yeah.
But really, they're like, how can we reduce these emergency room visits?
Yeah.
How can we make people come less often? And so I got a grant to study loneliness.
Okay.
And I was an introvert, nerdy, electrical engineer, now in medicine, being handed one of the toughest questions in the universe. How do you make someone feel
loneliness?
But again, I don't know what it was, but I kind of said, okay, sure.
Yeah.
I'll do that.
Figure it out.
I'll figure it out. And I thought of a couple of my patients who were doing some craft work in a local library, and they were happy. They were those people who were sick and happy. And so I said, okay, well, to reduce loneliness, I'll just bring people together.
Makes sense.
Yeah. So that was kind of the idea for it. We had funding for a space. We chose a funeral home.
It's a good place to start.
Yeah, had a lovely treadmill, very long,
Wow.
lovely treadmill, beautiful velour carpeting and walls. We did have to do a seance to clear the air.
Okay.
And I started
a good idea.
I started a group for diabetes.
Okay.
And I used evidence once again. And so you should know I worked in the poorest community in New England at the time, a place where most of my patients spoke Spanish. They were mainly from the Dominican Republic. So there's a lot of cultural things I just want to say before we talk about this.
Yeah.
So I looked online, and online was brand new back then.
When was this? Like what year was this?
Oh my God, 1996.
Okay. So yes, online is very new.
It wasn't like pictures internet. It was words.
Yeah.
Not a whole lot there. But you could start to look up medical research online and look at abstracts anyway. And so this was my approach. Okay, what am I going to do with a group of people? What am I going to do with a group of diabetics? What are the best treatments? And back then, they thought that Tai Chi was the best exercise to be doing. They felt that education in groups seemed to be a good way to go. And those were the only real 2 pieces.
Okay.
So I said, okay, I'm going to do a group visit. It's going to have some education, It's going to have some Tai Chi. And I'm going to do cooking because I felt like food is probably important in diabetes too.
Yeah.
And nowadays, boy, that would just be obvious. But just back then, I was avant-garde.
Yeah. Yeah.
So I said, okay, come to my funeral parlor and we'll start a study.
Okay.
And what do you think when I started telling my Latina patients, let's do Tai Chi?
Not received very well.
This music isn't fast enough. This music isn't loud enough. Oh, okay. We're going to do some cooking. Where's the rice? No, we're not going to eat rice. What are you talking about? You got to eat rice.
Yeah.
Right. And so, I would say quickly, but, it was a CDC study. And by and large, even though I don't think I was doing group visits well back then, and I can tell you maybe later in this conversation why, but they still liked it, because my intentions were good and I was bringing people together, right? People who had something in common, and what they had in common was just the diabetes was just one small part of it. They were feeling lonely, isolated from their families, having a sense of trauma, coming from all they'd come from. It wasn't easy to make ends meet in the city back then. And so, I was bringing people together. And after 3 years, we had these great outcomes.
Wow. So what kind of things did you find?
Well, it's published.
Okay.
And
we'll link to it too.
you can link to it.
Yeah.
But basically, people lost weight. Their blood pressure went down. Their A1Cs improved. And their loneliness improved. Even though it's a 3-year study, it was like after month 3, the loneliness was better.
Wow.
We could end it a long time ago. And then it was supposed to be a 5-year study, honestly. And but at year 3, my patients revolted.
Okay.
So when you bring a group of people together and you become friendly, almost like family, they can tell you, can we stop doing this Tai Chi? And can my brother come?
Yeah, they called you out.
And you go, well, it's a CDC grant. It says we're doing Tai Chi.
Yeah.
They're like, well, can we start another class then afterwards? And I said, well, what would we do? Oh, well, we would dance. Okay, but I can't teach you to dance.
Yeah.
They said, that's fine. I know how to dance. Well, what will we listen to? Oh, my son has a boombox. We'll bring the music. Okay, so I guess we're not using this space afterwards.
Yeah.
So very quickly we started another group, and it was like doing, I would say, a lot of what Zumba is. We were doing Zumba.
Yeah.
Not to trademark copyright
Before
anything like that.
Before it was cool.
But it was definitely Latin music, dancing, but not as athletic as like, aerobics.
Yeah,
It was just in this very loose area. And people loved it.
Okay.
So what do you think my study group people did?
They wanted to go to that group.
Absolutely.
Yeah.
So they said,
sounds like more fun.
this is, thanks, Dr. Geller. And guess what? They brought food to that group too. And that food had plantains and all the foods that people really liked, cooked really well. Right. And that was kind of the beginning of what I call the empowerment model. Okay. So what I had done wrong is I didn't go to the community and say, what do you guys need? What I did wrong is I grouped people by their disease. If I'm trying to reduce loneliness, I don't know if you're young, you may not have ever been ill. I have asthma.
Okay.
I'll share that.
Okay.
But I don't know if any of my friends do. And if I did, I don't know if it would affect if I'm friends with them. What are the factors that really make you friendly with people? Yeah. Well, it turns out you may not even be able to predict it in advance. Having things in common, like activities, that helps. So if you like exercising a lot, if you're doing CrossFit together, if you're like to cook, those could be factors that make you go, oh, maybe we could be friends.
Yeah.
We at least would like to do things together in our spare time. But the real thing that makes you friends is going through something together, spending time with each other in a way where you feel like that person really understands me and cares about me. Right? I didn't choose my parents. I'm different than them, but they care about me.
Yeah, they've been there for you.
They've been there for me.
Difficult times, yeah.
Yeah, I have friends who aren't vegetarian, but boy, they're there for me. I'm a vegetarian.
Yeah.
Does it matter? No. Yeah. So, that secret is to actually bring people together and have their input to make their own environment. And then for me to facilitate it, because not everyone likes to go to a meaningful place in a conversation. Like we didn't start our conversation today with what's the most meaningful thing to you.
Right. What's the
It's
purpose of life?
It's like,
yes.
how are you? Where are you? What do you do?
Right.
Those are nice questions, but they're not really too meaningful.
It's interesting what you say about going through something difficult together, because I'm always thinking about this in context of the CrossFit community is something I'm involved in. And we always talk about what makes that community, what makes that bond so strong. And I always come back to, I think it is that you go through really difficult workouts together. You push each other, you see each other overcoming challenges. And I think that is really what brings people from different walks of life together that are friends that otherwise probably wouldn't be. So we're seeing it in the CrossFit gym too.
Bingo. Yeah, absolutely. And, I create those environments without exercise. You can create them with yoga. You can create them just by talking. And what people are going through in an underserved community, like where I work, are, the real life things. Having a child in prison, having infidelity. Our city had a series of gas explosions.
Oh gosh.
And fires, and everything you go through has a negative to it. But boy, what a great community in terms of strength, that we're in right now. And I personally, I've just changed my practice, and my patients are all coming with me because we've been through things together. When you talk about a relationship with anybody, including a physician, was I there for them when they were sick? Yes. Right. And in CrossFit, if someone's struggling, are you there and coaching them? Is that, I don't know the model of CrossFit too well.
Yeah. The sort of the typical thing we talk about is at the end of the workout, the last person who finishes gets cheered louder than the first person. So sort of if you finish the workout first, you're cheering on all the rest of the people who are finishing. And it's more about helping people to overcome their obstacles or, pushing themselves through when they want to quit. And so there's a lot of sort of celebration of that.
Yeah, we do. And the group model that we use now, which is the empowerment model, it's really about building relationships first, right? And the way you build relationships is by being together and doing things together. And so I might even have everyone cross the finish line at the same time.
Yep.
And everything we do, if it's exercise, you're handing the ball to each other.
Yep.
If you're doing yoga, you're sitting next to each other. You're asking people how'd it go. So I'm constantly thinking, how can I introduce relationship into this activity we're doing?
And some of the ways that you do that, like you talk about, obviously people coming into these groups, if they're already feeling maybe lonely or isolated, or maybe they're introverted, like you said you used to be, what are some of the things that you do in facilitating that helps people to sort of feel comfortable and be able to start having those vulnerable moments?
Well, I've learned a lot. So I'm going to give you the hints, but I want you to know that I made a lot of mistakes.
Yes.
Okay. So anyone out there who wants to work in groups, don't be afraid to make mistakes, because if your intentions are good, everyone there will know that, and you'll be off the hook. But, so I could phrase it as the biggest mistakes I see, but things I try and avoid is putting people on the spot, and people might come late. You don't know why they're late. So you make everyone feel welcome. Like, oh, it's good to see you. It's, we'll make room for you. You're welcome here. And instead of going around a big circle and saying, what is your name and why are you here and what's your favorite ice cream, things that aren't meaningful, I try and create environments of meaningfulness. So we would break into small groups, let's say. And I would randomize people. So I don't want friends. If you came with your husband, I wouldn't have you talk to your husband. You can talk to him anytime.
Right.
You're going to meet someone new. You're going to learn how to build relationships. In this group, we are all connected. It's not you're with your group of friends and they're with their group of friends. And by breaking into a small group, then you can have a meaningful conversation because you're not talking in front of the whole world. So I can say, okay, tell your partner what's been difficult about having diabetes this week, right, or month or whatever. And then the people in the group have a conversation, and then I can turn to the whole group again and say, did anyone hear something that was particularly powerful to them? And someone might say, Jose says that he's peeing every hour, and he can't get to New York to see his family because he can't go on a bus because he can't. Wow. Has anyone else felt that way? And you see actually a couple other people raise their hand. It makes Jose feel like,
hey, I'm
not alone here. Yeah. He didn't blow his own spot. Other people did it for him. And then the group can give encouragement and ideas like, hey, I'm driving to New York. I have to pee every hour. Why don't you come with me? Before, the doctor inside of me would have said, we got to fix this urination problem. But the problem is seeing his family. And that was solved. And so, you do things like that. I guess I gave you an example instead of specific rules. We try and do activities, I said, that involve everybody. And we try and group people not by age or disease, but by who they are. So if you're in a young woman who works and is a single mom, it would be good to be in a young woman who works, single mom group. We have so many groups that have started in my new facility already. In the old place, we had over 50.
Wow.
But we have groups for, we have yoga, we have chair yoga, we have a massage group, we have osteopathic manipulation done in groups. We have support groups. We have what we call a functional medicine group where people are trying to not use medicine.
That's awesome.
And you can be successful at that. We have meditation and mindfulness groups. And we also have medication refill groups.
No.
We have physical exam groups. So if you need a physical exam, you're not getting it alone. You're getting it with other people.
Wow.
Yeah. And it's amazing because in a regular physical exam, I've got 25 minutes, right? And I might ask you about things. But in a group physical exam, I might have 4 patients together, and I say, who had the healthiest breakfast? And it starts a conversation which leads to real world answers.
Probably more impact in terms of their insight into their own health and their ability to maybe implement some changes or think about their health in a different way.
Yeah. And then I've been doing this for a while. Those people say, can we come back together next year?
Now they're physical exam buddies.
Yeah. And it's almost like every year, hey, what's changed with you? And so it stops being about a physical and more just like a little family get together. The physical exam, unfortunately, we're finding our actual exam isn't that important. I'll make sure they get colonoscopies. We'll make sure they get mammograms. We'll take care of what needs to, because there is real medical care. I'll meet with people individually for some time during that visit, but they're going to learn a whole lot more about the world and everything. Then my nurse comes in, gives the vaccines. I'm not going to get it. I am going to get it. Who's going to get it? Who needs what? Yeah. Everything is like a conversation.
Yeah.
And
that's so cool.
and I think that's one of the ways it should be.
Definitely. You mentioned the different types of groups that you have now. What have you learned over the years about how you structure the groups in order to get the right people together, or how you sort of advertise them to get people to be with other people like them?
So I think you just think of the most common diagnosis and you make a space for those people.
Okay.
Right. So it's back pain and headache, right? And then you have sick visits and things like that. And so, but instead of grouping people by their disease, so for you, for back pain, maybe yoga is the answer. Maybe for another person, it's a massage. Maybe for another person, it's medications, right? Another person, it's exercise, right? So helping them figure out what they can do.
Okay.
To make their health better. And then they'll kind of get to explore different groups. What we basically created is open access. So people love it. They'll call up, oh, I have back pain. And then the receptionist will say, would you want to come to the acupuncture group or the massage group?
Right.
Or, what do you need?
So it kind of eliminates almost your need to have an office visit with them first and just say, hey, let's empower you to try whichever modality you want to try.
But we bill for those. They're office visits. It is a business, but it's one where I think we have the biggest impact and give the most back to our patients. They get so many services. We try and, in terms of reducing loneliness, we have a tremendous team. So my staff has been with me for years. Shout out to Marisol and Crystal.
Awesome.
They're amazing. And they kind of on the phone, we'll talk to patients too and get a sense of where they belong.
Oh,
You know,
very cool.
we have fewer men than women, but we have a couple group that are predominantly men. You know, and so their exercise tends to be more weightlifting, and it's stereotypical, but it's what's happened, right? And so they honestly do a lot of the support for our patients.
Okay.
You know, when you do things in groups, it's not me, the doctor, solving things, because I couldn't, and I probably can't anyway. It's people finding someone who really understands them and understands where they're coming from. I'm not a poor Latina woman. I'm taking care of women, you know, and so if they can give each other advice on what they do, where they can get fresh food, where they can do things, what's going on in their community, they're going to support one another, you know, better than I ever could. And yes, I'm there and I am respected in the group and I participate and I think I'm really empathic and I really understand what's going on. But, you know, that's not the cure for loneliness. We had these kids groups. And we used to have the parents decide, you know, it was every day of the week. You could come for a boys group or a girls group. And that was fine. And we had some money for transportation from New Balance Foundation. And then we started to get a little smarter. We said, why don't we actually have the vans pick up kids who live near each other?
That's smart.
It'll save some money. You know, it's quicker for the van.
Yeah.
But then these kids will actually know their neighbors.
Yeah.
And it's a truth that played out.
Yeah. Wow.
You would bring a couple van loads, 15 kids who all live within a couple blocks of each other once a week. And they'd be with us once a week, and we would do some meaningful things. You know, with the boys, I'd really be teaching them how to communicate. You know, with the girls, I'd be teaching them to stop communicating so much. And, you know, different barriers, different life skills. But then I'd hear that they'd seen each other during the week because, you know, they saw where each person's dropped off. Yeah. They know where each person lives. And to me, that's like such a beautiful, you know, so if the groups get canceled, they actually still have friends. They know where people live, you know, and, you know, we've done more imaginative things too. We've gone to the White Mountains to see the foliage. We've gone to the beach.
Wow.
You know, and these things enhance the relationships between people. You know, just the logistics of bringing people in wheelchairs anywhere, you know, is you know, makes people feel very helpful to help others.
Yeah. Wow, that's amazing. Have you ever experimented with different age groups? So like putting like young kids together with elderly folks or mixing the ages up anyway?
Yeah, well, we have some HIPAA requirements, so we would have to query every older person to let them work with the kids. So we can't do it quite like that. Okay. You know, anything over 21, those people are intermixing and seeing each other. But we've done over the years, we've done a lot of projects. We had one woman, her son died of a drug overdose, and so she wanted to get the word out to everyone not to use drugs. And so in one group, we made a video to not use drugs. And then I showed it to the teen group.
Oh, that's
And the teen group thought that was the worst video they'd ever seen.
Of course.
Not the ending that we thought, because the video basically just said, don't use drugs. If you use drugs, you're bad. You know, bad people use drugs. And yet, you know, a lot of people have people who use drugs in their family. And not everyone who uses drugs, no one who uses drugs is intentionally a bad person. Let me say it that way. Oh my God, right? And so, you know, it hit the kids in a way that wasn't good. So then the kids, I said, well, let's give them feedback. So I videotaped the kids saying, you need to tell us why, you know, you need to whatever. And then they started telling more personal stories. You know, my son, he was like this and he was such a sweet boy. And then he met this bad person and just once he used this and then he died, you know, and then they saw that video and said, wow, that was really impactful.
Wow.
And that happens over months. That's not like, you know, they did it, then
project,
they talked, then they did it, and they talked. But, you know, that's the type of enrichment that we're talking about.
Wow, that's so
you
cool.
know, and, you know, we have a Suboxone group. And this is maybe the most well-known thing we did in our program. There were 12 men. One of them was named Jason. A lot of them have been in and out of prison. They're using Suboxone right now, but they've been using drugs at other times. And he said, geez, I wish there was a book that I could read to my son. We're like, what about? What do you mean? Well, he'd been in prison for 6 months or a year, and he'd just gotten out. He hadn't seen his kid. He didn't want the kid to visit him, didn't want him to know he was in prison. he'd been using for the year prior to that, so he hadn't seen him then either because he didn't want his son to see him when he's using.
Yeah.
And now he's going to see him because he's clean, he's out of prison, he's in the Suboxone program, and he's petrified.
Yeah.
And the group, we talk, what do they do? What should we do? And so we went to the library and we looked for books on addiction for children, and there was a Berenstain Bears book, which, apologies to Berenstain Bear fans, but what they wrote in the 50s or 60s. It was basically Papa Bear was an alcoholic and was extremely violent with his children. Oh. And there's no way they could read that to their children. Yeah. Like that just, they're like, look, I use drugs, but I'd never harm my child.
Right. Yeah, that's not.
This is not the message I wanted to be. So we ended up writing our own book.
Wow.
Daddy used to be sick, and he used to hit me with a stick. And we for about 11 months, we went through all these different issues. A lot of them had been abused. Wow. A lot of people had other people addicted in their families. A lot of people didn't do well in school. They felt like at an early age they'd been targeted, or maybe had attention issues that were never diagnosed, and so each one of those became a page in our book, and an area where you could stop and then say, hey, young son, this is what, so there was a time when he wasn't there. I used to think he didn't care. I remember that was one of the pages. Yeah. And that's a time to say, I didn't see you, but I did care about you, right? So you can almost see reading the book. And So that book got published, and it's the #1 resource used, at least in New England, right now. It's free online. Daddy used to be sick, and he's much better now is the new title, because we couldn't say Daddy used to be sick. And how proud were the people in that group? They weren't addicts for a year and a half. They were authors. Right?
That's so cool.
They were people helping other people. And of those 11 or 12 people, 10 of them were clean for a year and a half.
Wow.
And in the field of Suboxone, 12% is considered normal, 20% is considered good.
Okay. So that's
for
huge.
4 months, I think.
Wow.
Yeah. Well, why? We know why.
Yeah.
Right? It's because their life was meaningful. And they weren't coming to the Suboxone group and being told by me, okay, who failed this week? Okay, who's dirty? What's going on? And so I was like, so any ideas, guys? What do we got going on? What are we going to put in the book? We got an artist, and we were going to have butterflies. No, we're not butterflies. What are we? So then we're frogs. We're rougher than frogs. So they became toads.
Oh, okay.
And then the toads got tattoos, and
lots of creativity.
But all the groups do things like that. And doing projects together is what really builds relationships. Other mistakes that I've learned from: don't ever end groups. Let people choose when they shouldn't be in group anymore. If I said, look, we're meeting once, I don't need to know everything about you, Julie. You seem like a really nice person. Met your husband. He seems really nice. Looks like you're going to have a great career. CrossFit seems like a really great community to you. That's all I know. And I'm rooting for you, but I don't know that I'm going to see you and communicate with you. So I'm not taking the time to get to know you. Well, that's what our patients do as well. So if I say I'm going to have a 6-week class on diabetes, they're not like, oh, I'm going to be with these people for a long time.
Right.
It's like, well, okay, what do I have to learn? And let's say they don't like education. So then that group's no good either. Right. So what you do is instead you say, well, we're going to have an ongoing program. And so let's actually spend this first session getting to know each other and identifying what we want to learn for the next rest of our life. And then that's been the most successful strategy. And there's some people who never leave. Maybe they don't have other family. We celebrate Christmas together. We celebrate Thanksgiving together. We celebrate funerals together. We celebrate births together. And a lot of doctors may not feel comfortable with that, but that's like the best way to heal people. I was telling people avoid egg yolks at the beginning. Now I tell them eat egg yolks. I was telling them drink diet soda. Now I say don't drink diet soda. I'm telling them take beta blockers. Don't take beta blockers. Yes, take beta blockers. Wait, only take beta blockers now if you had a heart attack. Wait, stop it altogether. Only if you had a stroke, right? So like I know the whole profession has issues. We're just trying to do the best we can. And our patients are trying to do the best we can. But if they know you as a person and you know them as a person and they know each other and you as a physician are outnumbered, then they're empowered. And people are really getting the care they need the way they need it. And, it humbles you. It humbles everybody. It's just like, anyway, so I could go on.
Yeah. So talk a little bit about how you implement this in sort of a medical setting in terms of the logistics of billing, doing, like you said, they're open groups so people can come as often as they want, but at what point do you bill for medical care, and how does that work as you flow through?
So I'm going to tell you all the resources you need are at a new website. So I started a nonprofit called the Integrated Center for Group Medical Visits. Excellent. My partner, Paula Gardner, she's maybe the lead researcher in group visits in the world.
Okay.
If not, she's right there.
Up there, yeah.
And so I probably have the most experience doing group visits, doing 50 group visits a week for 25 years. So together we're working to make sure that it's easy for people to do group visits. We make our money being doctors, right? This is a true nonprofit just to protect us and make sure that people have the resources they need. And so there's manuals there on how to do it. So just check out those resources and see the research that's done. We have trainings that people can come to in person, but we also have what they call webinars, which will be free and just, so that people can learn that way. Yeah. But to answer your question, you bill patients just the way you normally bill patients. And the group visit and the group activity is free of charge.
Cool.
Right, so it's just like the most exciting waiting room ever in the planet.
Right.
So if you're doing Zumba,
I love that. The most exciting.
If you're doing CrossFit together, just imagine you're doing CrossFit, but then there's a doctor right there, and once a month, once every 6 weeks, if you have a chronic illness, I know a lot of your CrossFit patients maybe started having chronic illnesses, and they're using this as a way to treat them. Well, they need to be monitored, right? It's not a good idea to lose weight really quickly without eating well and doing things the right way. Right. And so then the doctor says, hey, Jimmy, come here. I'm going to talk to you. How are you doing? How's the family? How's the job? How's life? Oh, you have pain in your shoulder. Okay. It's muscle. Don't worry about it. No, it's joint. Hey, maybe we should do different exercises. And then you bill for that encounter. You say, okay, well, I just saw him. He has shoulder pain. I'm billing for shoulder pain. Continue your CrossFit. And what you're doing is you're being generous as a clinician. You're using the money from that individual visit to pay for these other services. Now, I'm excited to potentially be entering into a capitated system, which means that you get money up front for taking care of your patients. And that changes everything. Right now, I know it's a cliche, but we're doctors, we're kind of paid for keeping you ill.
Right. We get paid when you're sick and you come in to see us.
Yeah. So if you come in 30 times a year, I earn 30 times as much as if you come in once a year. Right. And that kind of drives it. This new capitated system, which I can't wait for it to, it exists in some places, in some ways. But let's say I'm given $3,000 to take care of a patient. Well, or let's say 1,000 patients. Well, suddenly I have $300,000. And I'm positive that patient will use the emergency room less. They'll need less medication prescriptions. I'll be able to give them services like yoga, tai chi that keeps them healthier, massage. We'll be able to build connections between people. And, that makes me want to keep people well.
The motivation is aligned. Incentives are aligned.
So, right now, though, that's not the going model. The going model, so in a Suboxone group, if I have 8 to 10 people there, we all talk in a group. I pull them aside individually. We discuss their urine results and if they're clean or dirty, and we give their Suboxone if there are other medical issues. In a diabetes group, I might only bill them every 3 months. They can come to the group as often as they want, but every 3 months I'm going to check a hemoglobin A1C and do the real diabetic care that I need to. In our sick visit group, well, that's just people come in when they're sick. So, if there's 6 people in the group, I'll bill all of them. And so what really makes it work financially is that I'm seeing 5-6 patients per hour, right? And doing a better job than I would seeing 2 or 3 patients an hour. And
not to mention the patients are happier, because otherwise you have patients sitting in a waiting room. Maybe you're running behind. They're getting irritated. But now, all of that time is being utilized in a positive way.
Paula has made me aware of so much research out there. I believe it's 5 visits before a patient feels less stress and less loneliness from being in a group. Providers in about 6 months are like a million. This is not true data, right? 1,000,000%
a lot
happier with their jobs. They're less likely to be burned out. They're part of a healing team. All the outcomes. I've I've maybe seen a couple studies which show that group is no better than non-group, a couple. And then I've seen thousands of studies. Ariana Thompson Lasted, she did a PhD thesis on group visits and really put together all the abstracts and everything. Those are available on our website as well.
Perfect. We'll check them out.
Yeah.
And it probably, like you said, it depends on how you do the groups, right? Is how effective they're going to be, because I think a lot of times you see groups as a way, maybe they're trying to solve the problem of, let's see more patients faster if we can do it all in a group, and it is a closed, or I don't know what you call that. So yeah, finite number of visits.
An open visit. You invite people, they can drop in when they want. They can come as long as they want. An enclosed model is like that 6-week diabetes group. And I don't know where the CrossFit community is in terms of this, because if you're more empowered, actually that short-term educational model can work. If you're working in an underserved community, I can't just say eat healthier, because if you don't have the money to buy the food and you don't, you don't have the resources, then it's going to take a lot longer for us to figure this out.
For sure.
But in a resource community, like if people have jobs and they have some money and they can, I can simply say this is the best diet and people can do it.
Yeah.
Well, then an enclosed model's better. And it is appropriate to bill people each time they come and to give them real care and information so that they can be more independent.
I want to ask some more questions too about doing functional medicine or integrative medicine in underserved populations, because I think so many times people hear those terms and they think, oh, that's only for people who have a lot of money, or I wouldn't be able to afford it or implement it with my population. So can you talk a little bit about what that's been like for you and working with your patients?
Right. So integrative medicine isn't covered by insurance. I helped found and was a past president of I Am For Us, which is integrative medicine for the underserved. And that's an organization that just recognizes that if you're poor, you can't afford a gym membership. You can't afford a massage. You can't afford acupuncture. But if you're wealthy, you might pay for those things, and they'll help you feel better and help you manage your illness. And so there's many levels I can answer this question. Me as a physician, I had to learn how to do those things. So I learned acupuncture so I could provide acupuncture to my patients. There weren't any acupuncturists in my community because they wouldn't be able to make a living. And there weren't people trained in acupuncture. It's not part of the culture of our community to say, I'm going to learn acupuncture.
Right.
So one of the things that I'm very proud of is I've helped nurture in our community people who've learned skills. We have 4 or 5 people doing exercise in our community, and I'd say for sure 4 of them started in my group programs. We helped get them trained to be exercise trainers.
Wow.
And now they're on their own and they're helping the city.
That's so cool.
Our current massage therapist worked with us, and she got credentialed in massage. And now she's going to start her own private practice doing massage in our building at a discounted price because her rent will be free, right? And she's giving massage to our patients, usually in groups of 4 or 5. So everyone gets a 15-minute massage. They get 15 minutes on a table with a heating, device. They listen to music with earphones for 15 minutes. By the end of an hour, 15 minutes, people feel like they've been in a spa.
Wow.
And coming from our community, that's not that common.
To
so, the first thing is we're developing talent within a community that can help the community cure itself. Right?
Talk about empowerment.
Yeah. The second level is, getting at the functional medicine. I love functional medicine, but our current billing models make it very difficult to take care of, the reimbursement for some of my patients is less than $50. And, you have rent, staff, insurance, you really can't make a living if you see one patient an hour. It just wouldn't work. And so what we do is our functional medicine, we do it exclusively in groups. We don't do, there is a lot of people think you have to do hair analysis and all these crazy tests. I'd say, yes, there are crazy tests in functional medicine, but they're not stupid crazy. They're just crazy expensive, and I wish they weren't so expensive. A lot of people have exposure to toxins. We just can't test them, but we can assume they have them, right? And so when you really boil it down, we need less stress. Okay, well, that's what the groups do.
Yes.
We did a study on our pediatric obesity groups. 70% of our boys lost weight over 4 years. I don't know any other study that's had results
Yeah.
similar to that. It's not a randomized controlled trial, so I can't stand on a rooftop and say anything. But the biggest thing that correlated with the weight loss was stress reduction. And in fact, stress reduction correlated more than drinking sugary beverages and more than exercise.
I believe it.
So
believe it.
does CrossFit reduce stress?
So that's a really interesting question.
I bet it does.
Yeah, I think that it does. I think a big part of it's the community, the exercise outlet. I think, it can be overdone though, for sure, and cause stress in other ways if people are kind of burning the candle at both ends, which tends to be the type of person who does CrossFit is a person who's a very, intense sort of person.
It's okay not to be perfect.
Yeah, exactly.
Okay.
And so I think that's sort of one of the things that we try to help people realize. You don't have to be setting personal records every single day, or, sometimes it's okay to, sleep in if you need the sleep, or be with your family or whatever, and not beat yourself up about missing the gym. But I would say overall, it definitely reduces stress. And I think a lot of that comes from the relationships, the community, and the exercise.
So if I take someone who's poor and I see you need to eat pomegranates every day or you won't be healthy, but no one even sells pomegranates in the city.
Where do you find those?
And if maybe it's too expensive anyway, that person's going to have more stress after my interaction, right?
So they're like, oh, I can't get pomegranates. I can't get healthy.
But if I say, what's one thing you think you can do to be healthier? And then a lot of the functional medicine ideas, and I credit Robert Luby, who I think is still involved in the Institute for Functional Medicine in a great way. He helped me develop our fellowship in Lawrence. He's taught me quite a bit. Just shop in the aisles at the outside of the supermarket. You don't need to be wealthy or poor to do that.
Right.
Eat the rainbow, and I'm not talking M&Ms or Skittles. Eat the rainbow the most you can, right? And for our community, it means maybe frozen vegetables in a microwave. Yeah. And for other communities, it means fresh organic. Okay, but we do what we can, and we do it in a way that's like you're a superhero for doing it, not like you're failing because it's not organic, and it would be good if you can give up that gluten,
right?
Because that's not really helpful. And so then you build community, and you have people who are working towards not being on medications and being healthier, and we do get their whole history. It just doesn't happen in 1 hour every week for 3 weeks. It happens over a year or two. Yeah. And it's just a different pace, but it's still, functional medicine, I hope gets reimbursed better. It's part of the policy change you need. Massage isn't covered by insurance. Acupuncture is starting to get covered. These things have yoga. These have true evidence that they're superior to a lot of the medications that we're able to prescribe and get covered. Right. And so Integrative Medicine for the Underserved is a great organization. Our conference is going to be in Wisconsin at the end of August, in just north of Chicago in Milwaukee. Okay. And so I'd urge people to go there if they're looking for community on how you take care of underserved populations, yet still want to do functional medicine, want to provide integrative care. It's a place with a lot of solutions.
I love that. And sort of leads me into my next question, which is, I think obviously you are doing a great job of bleeding what we do in medicine into the communities that people are living in. And so many of the problems that we have, medical problems that people have, are obviously rooted in the way that they're living their lifestyle, or the way that our community has sort of set them up for these things, whether it's the, poor quality foods that are the cheapest, or whether it's the, the work life that we live where we are feeling very isolated, or the lack of social connection, or, the lack of time for exercise or other activities, the lack of insurance reimbursement for a lot of these things. And so that's where sort of my question and frustration comes is, are these all, we're paying the price for it as a medical field. We're kind of like faced with all of these medical problems that people have that are rooted in their lifestyle, but yet a lot of the solutions are not being covered by insurance, or they're not supported. So we have to go out and do more creative things like you've been doing to address these problems.
But it's a bit of a game, because there's an even bigger problem, which is racism.
Yes.
And corporate America.
Yes.
And it's about money.
Right.
I don't want to give any political views here or anything, because I think whether you're a Republican or a Democrat, you probably care about our country and you want everyone to have, good health care and an even shot at things. But I don't know that yoga is the answer to everything. Education might be, clean drinking water,
Right.
a feeling that you're not oppressed, a sense of confidence that you're getting a fair shot. That reduces stress more than anything that I can do as a physician.
Yeah.
And so I spoke in front of Congress last year, and I Am For Us is doing a lot of political action because I think we as a society are having this revelation that what we think is fair isn't really fair. And this is a bigger topic maybe than the health you want to hear about in the podcast. But what medication is covered by insurance, and how come it's really expensive here but not expensive in Canada? And how come you need to have a job to have insurance, but if you're sick, it's hard to have a job? And
doesn't make sense.
And then it doesn't make sense if you look at it in terms of what we can do. So I wish I wasn't being so creative and working outside the system.
Right.
I basically have created a private practice for the underserved. So I can have the control over making decisions, which you can't have in sometimes a health center or something like that. And I can collect reimbursement, not at a rate that's really great. I can make a living though. And really I look at people who I'm taking care of and go, that wasn't fair. They're not ill. The idea that you're a drug addict because it's all your fault, not true. And so we need to make big changes as a society. There aren't good doctors, there are only good patients. There aren't good patients, there are only healthy communities.
Yeah. It's so true.
So, it's if you're wealthy, you live longer.
Yeah.
I mean, that's not fair, right?
But so important, I think, the work that you're doing, because I think it can be so easy for a doctor to, go in and do their job and see the patient sitting in front of them. But like you said, unless we start addressing these bigger community, societal level issues, we're not going to be able to keep up, I think, with the problems that people are having, and we're not really going to help them fix anything.
Yeah. The optimist inside of me thinks that the system's about to fail.
Yeah.
So,
I totally agree.
So then it's getting more expensive each year. Everyone realizes we're spending too much money, and why are these other countries getting better results and spending less money? And they're usually aren't, I know the freedoms. I want to be free. I'm in the United States. Let me do what I want.
Yeah.
And so we don't want to give that up. And I don't think we have to, but I think people feel threatened by that. And I think that the people who do have resources really don't realize how lucky they are. Sometimes they'll see poor people and say, oh, they're getting free health care or free, but it's like, well, but who helped build this city?
Right.
And yes, this one individual person, maybe be getting free health care, but don't you live in a better house?
Yeah.
So, so I think that actually I'm part of the change. We're proving that there are other ways of taking care of people. Physicians, healthcare, us doctors, we only earn 6% of each dollar that's spent on healthcare. The rest of it is going
overhead
everywhere else. Well, overhead, emergency room, transportation, but the actual clinician, and I think some of us clinicians are overpaid.
Yeah.
In some fields for sure. Family medicine probably not as much.
Maybe not, yeah.
Pediatrics not as much. Okay, guys, but and so if we just could get 9%, then I could run a clinic that provides. I'd be then taking money out of the other people who are getting it, but in exchange we can make real programs in communities. That really, there are problems. Children don't have equal parents. Some parents are very well educated and then can help their child. Right. And so things don't need to be equal. Maybe you need to give more to some people. And I'm not trying to advocate any of these things, but well, I guess I am, aren't I? but I don't know what, right, or the specifics, but if my model works, I'm positive people can copy it. And group visits certainly have been part of the solution. You see a lot of patients. You provide more services. You overcome barriers. You do it in a culturally competent way. People get to know one another. They have a better sense of community. They're less scared. They have less anxiety, less stress, and then they have better outcomes. And I get credit for, as a doctor, when my patients have better outcomes and have so little to do with it, that if at least I can put them in a good spot to get healthy, I'm moving the right way.
I love it. What are some of the biggest things that you've learned from your patients or from these groups over the past, I don't know, however long you've been doing them?
So I've been doing groups since 1996, I guess. So I'm not sure when this will air.
Yeah, 23 years.
25?
20, yeah.
24?
Oh, wow.
Whatever.
Two engineers trying to do some simple math.
Well, it depends on, when were you born? Was it when you were conceived? I don't know. When did I first talk to people in a group? Was it at that meeting in middle school?
Yeah.
The biggest things I've learned, I think I've already shared them with you. There aren't good doctors. There are only good patients. I like to think I'm a smart doctor, but the smarter doctor doesn't do as well as the caring doctor and the doctor who the patient trusts. And the way the patient trusts you is you're caring over time. And so the length of the relationship also matters. And all of these little things, staying in a community. When I changed jobs, I stayed in Lawrence. Not the easiest place to work, but I didn't want to give up. These are my people. I love my patients, right?
That's beautiful, the part about caring, because the founder of CrossFit, Greg Glassman, whenever someone asks him, what are the most important things to do to become a good trainer? He says, care, and care. He's like, you're going to learn how to do the movements, how to teach people, all these things over time. But if you genuinely care about your clients, then they're going to keep coming. And then you're going to, get there and you're going to learn the other things that you need to know.
And my clients care about me. It's kind of embarrassing to say that, right? But if I'm having a bad day, I've had loss in my life, things happen. And geez, hey guys, this is what's going on. When I was going through my job transition, my patients threw me a party.
Aww.
There were like 200 people. And I don't cry that often, I guess I'll say, but I was actually crying.
Yeah, wow.
And I was like, okay, I'm not leaving. All right, guys, we will figure this out. We will figure this out. And my patients have inspired me to do things. I wrote a children's book, Herschel the Jewish Reindeer, because I would work every Christmas because I'm Jewish and all of my colleagues aren't. And then I share that revenue. We then donate it back to our programs. And, I've been inspired in so many ways, just to be a better person. That introvert who is just very about solving I'll call them now simple problems. How do I think I was working on the control of missiles at Raytheon. How do I get it to fly straight? That sounds like a real problem. But how do I help Eduvijas with her bad toe? There's not like I'll just take the matrix and take the logarithm and multiply it. No, it's like, I guess, Eduvia, what do you think you need to do, Eduvijas? What are we going to do? Right. And, that's the work, I guess.
I love it. So I want to wrap up with 3 questions that I ask everyone on the podcast. So the first one is, what are the 3 things that you do on a regular basis that have the biggest positive impact on your health?
Well, I read to my son, and my wife's laughing because she wishes I did it more. I get, they're all about family. I talk to my parents on a regular basis. And I will say that the people I work with and my patients are family. Is that 3 things?
Yeah. It's all about the relationships.
Yeah. And I definitely did not know that as a kid. You started the interview.
Right.
When were you a kid? What were you like? Right. And it's like, I wasn't as bright, but I probably was quicker and smarter.
Yeah. There's different areas of wisdom, I guess.
Yeah.
What is one thing that you don't do or you have a hard time implementing that you think could have an impact on your health?
I do a lot of very healthy things, so that's hard. I have a bad knee, so I go on a treadmill, on a Stairmaster for a half hour 3 times a week, because if I don't, my knee hurts.
Okay.
And that's hard to do. Sometimes, here, I'll go in a different directions. There's something inside. It's hard for me to say sorry. Like there's this instinct to blame other people when things go wrong. I'm getting better at identifying that.
Okay.
How's that sound?
That's good. I love it. The last question is, what does a healthy life look like to you?
Well, it's no longer a long life. I think I used to say live as long as possible. I think it's all about relationships. Yep, it's about relationships, and you need enough. You don't need a luxury house, but you do need a place where you can feel safe, where you feel listened to. You have people who understand you and care about you. So it's not all this ephemeral stuff. You do need physical stuff. Yeah.
I love it. Well, this has been wonderful. Thank you so much for sharing all of your experience. I think it gives me a lot of ideas as I'm starting out in my career, and hopefully people listening too, ways that, whether you're in medicine or not, ways that you can help to address loneliness and make some of those genuine connections with the people around you that are going to help us all to be healthier.
Yeah. And if we're ignoring poverty, ignoring the people who are suffering, I used to think, well, but you could still do good things. But now I think, no, you need to help people. You need to make that part of whatever your career is in the future. And, so everyone out there who's doing CrossFit, not everyone can afford to do CrossFit, but maybe there are ways that you can take what you're learning and share it with your neighbors, your friends, whether it's just eat a little healthier, exercise a little more, share what you know.
Pay it forward.
Pay it forward. Thank you.
Awesome. Thank you. Thanks so much for tuning in to this episode. I hope you enjoyed learning from Dr. Geller and that you gained some insight into the impact of loneliness on our health and how we can combat that by getting together in groups. Here are some of my biggest takeaways from our conversation. My first takeaway absolutely has to be Dr. Geller's empowerment model. I've seen this to be true in my own practice and in different areas of life, but it seems that creating an environment where people feel supported to come up with their own solutions is often so much more powerful than imposing our own solutions or recommendations on others. So it's interesting to think about other ways that we can implement this, obviously in a medical setting, but other ways in our day-to-day lives as well. My second takeaway definitely has to be the tremendous impact that our social and environmental structures have on our health. I think that we often overlook the impact of some basic needs, such as feeling safe, feeling supported, and feeling loved on our health. It's easy to underestimate the amount of stress that not having those things can place on us, and then the impact that that has on our health in turn. So surrounding ourselves by people who lift us up and can help us to build resilience and decrease stress is certainly an important way to combat disease. My third takeaway is that it doesn't have to be expensive to be effective. So I think so many times it's easy to get caught up in the latest health trends, especially when we think about integrative or functional medicine, fancy supplements, fancy testing, trying to have the latest and greatest to optimize our health. But especially as Dr. Geller highlights in this episode, as he works with underserved populations who often can't afford even really good quality food, it doesn't always have to be expensive. We can gain so much improvement in our health just by working on those basics, making sure that we have good relationships, that we feel supported, that we are in environments where we're doing meaningful work. Even some of the other basics like sleep, eating generally good quality food. It doesn't have to be perfect. If we have all those big things in place, then our health is going to be significantly better. And the other things are really just icing on the cake. So remember not to lose the forest for the trees when you're talking about the latest health trends or little details that you're doing to optimize your health. So hopefully you guys picked up a few takeaways as well and enjoyed the episode.
To make sure you never miss an episode and to receive exclusive content from me, head to my website, juliefouché.com, and subscribe to my email list. If you like what you heard, don't forget to subscribe and consider giving the podcast a 5-star rating on iTunes.
Also, don't forget to share your stories. If you or someone you know has used lifestyle to overcome a serious health challenge, please send me an email at info@juliefouché.com. I'll choose some of these inspiring stories to share here on future episodes. Don't forget you can train with me through Beyond the Whiteboard by visiting trainwithjuliefouché.com. Thank you again so much for listening, and I'll catch you next time on Pursuing Health.